So this is Mary Bell letter, and the nurse is Rajya Lakshmi. Here we have the letter. We are going to address it to Miss Jane Rudy, community nurse, Newtown Community Health Center, Newtown. Miss Jane Rudy, no need this much space, single letter space. This much is enough. Community nurse. She is not the only community nurse, so no need the here. Okay. So see here, community nurse. That's it. Okay. So Newtown Community Health Center, Newtown, right. 15 July 2017. Dear Miss Rudik, put a comma here. Put a comma here. Regarding no space before column. Miss Mary Bell, comma, no space. Age is 66, right. That's fine. Miss Mary Bell. Already here you put Mary Bell. Again, Mary Bell, no need. Miss Bell is enough. Miss Bell is a sexagenarian who was diagnosed with, then here you have to put a comma. Miss Bell is not needed also. No problem. Is not compulsory here. Miss Mary Bell, it's called apposition. Miss Mary Bell, a sexagenarian, comma, who was diagnosed with unstable diabetes mellitus. With a small infected left foot ulcer, comma, requires regular monitoring and appropriate management. Following the discharge, back home today. No need to. Back home today. Fine. On 24 June 2017, comma, Ms. Bell was admitted to our facility with the complaints of unstable diabetes. Was admitted to our facility for stabilizing diabetes mellitus, you can say. Okay. This is also fine. The complaints of unstable diabetes mellitus and a foot ulcer, which has been treated. With oral anti-hyperglycemic agents, glibenclamide 5 mg. So which have been treated, stable diabetes mellitus, metformin. So only foot ulcer has been treated or both have been treated? So which have been treated, this and this both, you can say. So it should be have been. If both, then have been. If both, then it should be have been. Okay.
Okay.
Treated with or are these anti-hyperglycemic agents for what? For diabetes mellitus or foot ulcer?
Diabetic mellitus, sir.
Okay, then glibenclamide, that is okay. Metformin for what?
That one also diabetic, sir.
Then what is for foot ulcer? So then these medications do not were not treated
because of diabetic only the patient will be suffer for the foot ulcer.
Okay, so these medications are for diabetes or for foot ulcer? These medications are for treating what? For diabetes mellitus or foot ulcer?
Libenflamide is the, I think that is one of the infection will be controlled.
Okay, then both of them, right? Let us see here. Medical hypoglycemia to be continued. Augment in your foot.
Antibiotic therapy for the foot ulcer.
Okay, antibiotic therapy for the foot ulcer. And the glibenclamide, okay, fine. So
I have written down, sir.
Yeah, then you can separate this one for that. Okay.
Okay.
Okay. Fine, you can just shift this position, which has been only there. You can remove that and you can say which has been treated. Okay, you can remove this one and put next. For the past 15 years, it has been treated for the past 15 years. Yeah, foot ulcer cannot be for 15 years, right?
No,
So
no,
that's
no.
it.
Therefore, small foot ulcer, I mentioned here, sir, sorry.
Okay, yeah, here this is fine. Therefore, small foot ulcer affected left foot for that administered antibiotic. Therefore, small foot ulcer. So the
Yes.
foot, therefore, is no need here. So the small foot ulcer has been affected left foot ulcer. The small foot ulcer on the left, the small ulcer on the left foot, or the small left foot ulcer was managed by antibiotic therapy, like that one. You can write. Has been effectively managed by, treated by antibiotic therapy. You can say like that. The small, you can say, because it's repeated here. Already introduced now. The small left foot ulcer. The small left foot ulcer. Here you are saying foot again, here you are saying foot. Why repetition? The small left, the small left foot ulcer. That's enough. Left foot ulcer has been effectively treated with or antibiotic therapy has been administered, you can say. The small left foot ulcer has been effectively treated with. The small left foot ulcer has been effectively treated with or treated by administering antibiotic therapy. Treated with antibiotic therapy. That's enough. Why too many words? Augmentin duophort twice weekly will be needed to be needed to be completion of the till the completion of the course. Augmentin duophort, D capital letter, F capital letter. It's a brand name. Augmentin duophort, brand name. See here, brand name. Okay. Orally twice a day will be needed. Will be needed. Or will be reviewed at the company, should be reviewed. A review has been scheduled. You can say a review of the a review of the one second, please. Okay. So here, a review of antibiotic therapy. A review has been scheduled. A review for a review of antibiotic therapy at the completion of the course has been scheduled. You can say like this. A review of antibiotic therapy. A review of antibiotic therapy at the A review of antibiotic therapy at the completion of the current course has been scheduled. Yeah. A review of the antibiotic therapy at the completion of the current course has been scheduled. Okay. Yeah. Moreover, don't use the word moreover. It is to be avoided. This word should not be used in the OET. Okay, there are some words which you should not use in the OET. Words to be avoided in OET writing. Words to be avoided in OET writing. So, list of connectors to avoid in OET writing. Okay, you wrote furthermore. Sorry, moreover. Moreover should be avoided. List of connectors you must avoid in your OET letter writing. Moreover, avoid that. So avoid that. Okay. Regular monitoring of the wound, daily dressing changes. The regular monitoring of the wound is required. Daily dressing of the changes are provided. Regular daily dressing changes have been provided. Are required. Provided. Need observation for any signs of complications. Regular monitoring of the wound. So change it like this. Regular monitoring. Regular monitoring. Regular monitoring. Regular monitoring. Regular monitoring. Wound margins. Observe for signs of complications. Also regular daily saline dressing changes. Monitoring the wound margins for any signs of complications and reviewing the healing process are recommended. So all these four together you can write. Regular providing regular providing daily saline dressing changes, comma, providing regular dressing changes, comma. Next one, monitoring the wound margins. Monitoring the wound margins, comma, monitoring wound margins regularly, comma, then observing for signs of complications, observing signs of complications. complications, signs of complications, and reviewing the healing process. And reviewing the healing process on a regular basis. Have been recommended. Have been recommended. Yeah. Have been recommended. Yeah. The next one, Miss Bell lives alone since retirement. Increased alcohol consumption and decreased dietary has been reported. Since retirement. Okay, full stop. You can write full stop here. Put a full stop here. Miss Bell lives alone. Full stop. Then increased alcohol consumption and a decreased dietary regimen have been reported. Increased, I capital letter, increased alcohol consumption and decreased dietary quality have been reported. Dietary quality have been, two things have been reported. Okay. Based on the aforementioned circumstances, appropriate supervision of medication compliance, dietary regimen, blood sugar levels, monitoring, and alcohol consumption. Encouragement would be profoundly beneficial. Based on the aforementioned circumstances, appropriate supervision of medication compliance, dietary regimen, blood sugar levels, and alcohol consumption. Supervision is already there, and again, why monitoring again here? And alcohol consumption would be profoundly beneficial. Alcohol consumption would be profoundly beneficial. Encouragement of moderate exercise program and establishment of income producing activities as well as social activities are we already used beneficial here, or recommended, you can say otherwise. Okay, would be profoundly beneficial or recommended, because you already used here will be beneficial. Okay, so here are advised or suggested. Then next one, establishment of income producing activities as well as social activities, as well as establishment of income producing activities, as well as social activities, as well as involvement in social activities, involvement in social activities will be beneficial, will be, not will be, will be beneficial to her only, there is nobody else. It will be beneficial. Will, that is enough. In case any additional information is required, in case, comma, any additional information, please do not hesitate to contact me, right? Yours is sincerely spelling mistake. Yours is sincerely spelling mistake. Hello. Yours is sincerely spelling mistake. Comma. SINCERELY, sincerely. Yours is sincerely spelling mistake. Register 2 lines, leave 2 lines. Leave 2 lines. Then registered nurse. Inpatient ward, W capital letter, Newtown Community Hospital, Newtown. Very good. W capital letter is needed. Community C capital letter is needed. Newtown, that's fine. So, what's the name? Rajya Lakshmi. Hello, Rajya Lakshmi.
Sir,
Yeah, you have got the letter corrected. So did you know, did you understand what I've been telling you? Is everything clear? Do you have any more doubts? You can ask me now.
no, sir, I was clear about regarding the gapping spelling mistake and caps where we need to use the capital letters. Repetitions. Should be avoid the repetition.
So far, I'll be sending this one into the group and also into the Telegram channel. You can collect from there. Okay.
Sir, pardon?
Okay, every day you can write a letter and send it to me, and every day you can get corrected version here. Okay. Okay, dear. Take care. Bye bye.
Thank you, sir.